Hello, can you guys hear me?
Hi, Doctor. Yes, we can hear you just fine. That's great. Okay, so Dr. Jeffrey and Dr. De Jong will be on now. We've sent them the link, so just shortly, we're just playing the sort of background. There we go. Hello.
Hello.
Hello, Samishni. Are we on, Steve, or not
Yes,
yet?
yes.
Yes, hello.
Good afternoon. And good
How are you guys?
good afternoon, and a special good afternoon to Samishni Mudli. I'm going to be introducing you very soon, Samishni Mudli. I think we have before in the past, but never mind. And with me over here is the founder and chief director of the Pelvic Floor Foundation of South Africa, the chief executive, CEO, and financial director. That's Professor Mudli.
Yeah, thank you.
No, it's Professor Jeffrey. And I'll just check in to see you.
I'm still awake.
Yeah. It's a wonderful day as I look outside Cape Town. Where are you based, Samishni? In which town?
In Midrand. We're here in Joburg, Midrand, Johannesburg.
And the thing about Cape Town tonight is very, very cold. We have snow on the mountain. If you look, there's a beautiful range of mountains outside the window. Snow, it's going to be 1 degree Celsius. And a special thank you then firstly to Next Bioscience, our sponsors, and also to the Pelvic Floor Foundation of South Africa. It's wonderful for you to be with us this afternoon, Samishni. We really look forward to your talk, The Future of Stem Cells. As I said to you a little bit while earlier, most of us know very little about stem cells. Do you know anything about stem cells, Steve?
No, not enough at all. But I mean, I think they've always been touted for so many things. And yeah, but I mean, I think we're talking specifically about this relating to newborns and banking, etc. So yeah, we're looking forward to hearing what you're going to say. And I think you can fire away. You can start clearing your screen. Thanks everyone for joining us after all this time. We haven't forgotten.
Almost 200 people here online, Samishni. No pressure.
No pressure.
Season 4, episode 14 of the Zoom meetings. Samishni is the product manager of Stem Cell Banking, Steve, and she also does newborn screening. So she's a really profoundly clever geneticist. She knows about stem cells, and she's a scientist of note. And remember, not too high and mighty, Samishni, because most of us, especially myself, know very little about stem cells. So I'm hoping you start quite basic. Without further waste of time, Samishni Mudli of Next Bioscience, The Future of Stem Cells.
Thank you so much. Yes, I'm going to share my screen, I think. Let me do that, actually.
And we want to welcome who's helping us run the webinars as well. So thanks so much. And she has replaced Ashley. So thanks very much to Karen for continuing the series. Yes, but yeah, fire away.
Okay, can you guys see my screen?
We can see Next Bioscience is the future of stem cells.
Amazing. All right. Thank you so much for the introduction. And hi, everyone online. I'm Dr. Samishni Mudli, as you know, I've been introduced. And I'm just going to give you guys just sort of touch on stem cell banking, stem cells, and then just where we are moving in the world with stem cells and what we could potentially be or use this for.
Sorry, you might want to put it onto presenter view because I think we might have a different view, but it doesn't matter. It's just that you might want to show us on the full screen view.
Full screen view.
Otherwise, you can see your next slide. We might get a bit distracted.
Does the audience also see the next slide, Steve?
Yeah. But it's fine. Carry on if you want to like that. That's fine. No, that's better.
There we go.
That's better. Yeah.
Now we do.
That's going to be a little bit easier. Thank you.
Thanks, Samishni.
Okay. All right. Let's get into it. Okay. So yeah, we are at Stem Cell Banking and at Next Biosciences. We basically do something called stem cell banking, which we collect the umbilical cord blood from the baby when the baby is born and the umbilical cord tissue, and we cryopreserve it. So we use it for, hopefully we don't use it. Sorry, my slides are just moving. Hopefully we don't use it, but in the future, if the child does need it or does need a stem cell transplant, then they could potentially use it. So I just wanted to touch on here at NextBio, we have two sort of products as well, just to give you an idea. We have something called private banking and community banking. Now in South Africa, I'm sure you guys are all aware, or if you are, we don't really have a public bank for stem cells. And we're trying to bridge that gap with something we call a community bank, in which if you are registered for stem cell banking and you want to be part of the community bank, we register you on the South African Bone Marrow Registry as well. So anyone in the country that's looking for a bone marrow donor or needs a stem cell transplant can potentially also use those stem cells. And then the differences between the products that we cryopreserve is we collect the cord blood, and the stem cells found in cord blood differs from the stem cells found in cord tissue. And we collect both and we can cryopreserve both at birth. And they're not interchangeable. So the cord blood stem cells are used for a specific reason and for a specific disease. And the cord tissue is used for a specific reason and a specific disease, but we'll jump into that. And then just more about the cord blood. So in the cord blood, we find hemopoietic stem cells. So those just means that it forms blood-forming stem cells. Now, that does the work of your bone marrow. So the hemopoietic stem cells can differentiate into your platelets, your white blood cells, and your red blood cells. And we, certain times where children usually need a bone marrow donor or looking for a bone marrow transplant, and it's really difficult in South Africa. The chances of finding that is 1 in 400,000, the stats here in South Africa. So, sorry, I don't understand why this thing keeps moving. Let me just pause it there. So yeah, it's a 1 in 400,000 your chance to find a bone marrow donor. And the nice thing about storing your baby's stem cells or storing stem cells at birth is that stem cells is 100% match for the baby. And it can be used as an interchangeable or an alternative to a bone marrow donor or a bone marrow transplant rather. So if the child needs a bone marrow transplant, we can do a stem cell transplant, which will be just as efficient. And then the current uses, as I've mentioned some of them already, is for cord blood, we have about 80 blood-related disorders that it can treat currently. And those disorders for stem cells, or the disorders that it can treat, are your bone marrow cancers, such as your leukemias and lymphomas, childhood cancers like nephroblastomas, anemias. I apologize, don't know what's going on with this computer today. Your anemias like sickle cell, especially inborn errors of metabolism. And internationally, it's still under the clinical trial phase, but it's been used in several clinical trials where they are introducing it in children with cerebral palsy, brain injuries, autism, stroke, and they're seeing really promising results from introducing cord blood back into the kids with these disorders. Then we come to the cord tissue. So we can collect the cord tissue itself. And in the cord tissue, we have something called mesenchymal stem cells. Now, these are completely different to the hemopoietic stem cells I've spoken about just earlier. And this can differentiate into your cartilages, skin, fat, tendon and ligaments, muscle. So the uses here are obviously exponentially much better or much vast. And we can get mesenchymal stem cells usually from the bone marrow, as we can with hemopoietic stem cells, the umbilical cord that is collected at birth, and then adipose tissue, which we'll speak about in later on, and where science is going with using adipose tissue. And then we come to the cord potential, or the potential uses for cord tissue. And this, because it can differentiate into so many various cells or cells, like your bone, cartilage, fat, it can be used to treat skeletal injuries, autoimmune diseases, heart and vascular diseases, neurological, wound healing, and especially now cosmetic uses cosmetic uses has taken this over completely with the use of cord tissue. And then the mesenchymal stem cells in the cord.
Sameshni, sorry to interrupt. Yes. Are you going to tell us about this business about cosmetic indications later? Because some people have already asked about that. You coming to that, are you?
Yes, I'm coming to cosmetic and plastic surgery. It's one of the studies we'll be talking about.
Okay.
And then just to mention that the mesenchymal stem cells in the cord tissue is actually found in the Wharton's jelly. So that's what we process and we store. And then, the cord tissue needs extra developmental work. So usually when we thaw it and we need it, or we need to use it, we need to expand it to create more and more cells, and then it's able to be used and transplanted properly. And then why should people store both? As I've mentioned, these cells are not interchangeable. So the hematopoietic stem cells and the mesenchymal stem cells are not interchangeable. So that's why it's good to have the cord blood saved and the cord tissue in case you need it for bone marrow or blood-related disorders. You can use the cord blood, and the cord tissue is for mesenchymal or connective tissue disorders. We can use the cord tissue. So those are the importance of why you need to store both. Then we're going to come to the clinical research and what's been currently done or has been done in the work that's going into regenerative medicine and the future of stem cells. Okay, and then let's jump into it. So in aesthetics, this is the cosmetic side of it. So just to give everyone, everyone knows that regenerative medicine refers to therapies to restore impairable tissue. So to meet a basic cell, or the basic definition of a stem cell, this cell needs to self-renew and differentiate into different lineage pathways. And as I've mentioned, adipose mesenchymal stem cells is exactly where we use what we use for aesthetics, because it can develop into cartilage, bone, muscle, nerve, and adipose tissue. So this is where, and this is why we're using it in aesthetics, because it's so easily manipulated and it's easily located. So we can get it minimally invasively. It's a minimal invasive technique where we can get the adipose tissue. So in aesthetics, in the UCLA in 2001, they discovered that adult stem cells in adipose, they found adult stem cells in adipose tissue. So the reason why adipose tissue is so popular in aesthetics is because the ease of access. So they do it through liposuction. They collect the adipose tissue and they obtain the adult stem cells from there. So we spin it down. Usually what happens is they isolate it, or the adipose tissue, using collagenase. So they spin it down into CVF, stromal vascular fraction containing adipose stem cells, and that's what we use to transplant. So this slide just shows you really nicely, when you collect the adipose tissue, it's treated with or broken down with collagenase, and we get this heterogeneous solution, and then we can go directly into transplant this.
Are you going to tell us, Someshni, where you're going to transplant the fat into?
So it depends.
Where would a person, man or woman, want fat cells? Surely they have enough.
So this basically can help with aesthetics. So if you want to appear your skin more fresher, you have wrinkles, people are starting, or the plastic surgeons are starting to inject that back into the skin. If you want to rejuvenate, facial rejuvenation for bigger lips, Botox, or not Botox, but you want breast enlargements, lip rejuvenation, facial rejuvenation, that's where these stem cells will come back into. So it's minimal.
You're talking about me. I need all of it, Steve.
I mean, it can even be used for scar reductions, hair transplants. So I think it can be used in such a wide variety in aesthetics. You think about it and you can use it because of this highly developmental cell that can basically repair and regenerate. The potential to use it in aesthetics is quite great.
So, but currently they're using the stem cells that they've got out of the fat, eh?
Yes.
Yeah.
Obviously, we're heading towards having something that is more further up the line and potentially more useful for the cord blood stem cells. Is that where we sort of talking about now?
Yeah, so the nice thing is, I mean, currently they're using it from fat, as you've mentioned. So from a liposuction, they can collect these adipose stem cells. But, these mesenchymal stem cells, these are adipose-derived mesenchymal stem cells, but you can get umbilical-derived mesenchymal stem cells too from the umbilical cord. So I don't think they're quite there yet in South Africa and using that, but I think we're getting there. Right now, it's just adipose-derived.
And obviously, from a gynecology point of view and aesthetic gynecology, they're starting to do sort of fat injections into the labia, bulking up some of the older ladies. And I suppose that's also, one of the big applications. Yeah.
And is it better than PCP? Because that's all we hear
PRP?
about.
PRP?
PRP. Are you familiar with Sameshni PRP? Or do you know Sameshni? Hello?
Me?
Yeah, sorry. Are you familiar with the use of PRP in aesthetics?
No. Is that plasma-rich?
Plasma.
Yeah, plasma.
Yeah.
I'm not sure the exact application of plasma in aesthetics, so I would be lying to you if I can tell you how it can differ. But yeah.
Yeah, Pete, from my knowledge, the PRP has been used extensively for injections into, I know a lot of people are using it for vulval disease, using it for lichen sclerosis. And I think for the mainline or gynecology aesthetics, people are using it to do these O shots, gin shots. I've seen Natalia's on tonight as well. She might have, there's a little bit more information about that. But yeah, and I suppose that's not the remit of tonight. These are question here from Relene Naidu, saying, I have a large number of Muslim patients. Is it acceptable according to the religious societies? And also in the case of patients who are Jehovah's Witnesses, is it acceptable to be using these products?
So I can touch on the religious aspects of the Muslim society. So we have a lot of patients coming to us to say that, is it ethically okay to collect umbilical cord blood and umbilical cord tissue? And it is, because I think ethically they don't want to cause harm to the baby and cause harm to the mother. And usually what happens when you do this collection, we clamp and cut the cord and the baby's already sent off to the pediatrician. So before the placenta is delivered, that's how we do this collection. So there's no harm to the baby, doesn't, cause an, I think the biggest concern was, does it cause an abortion by collecting these stem cells? And it doesn't. So, from an Islam point of view, we did a lot of research. Our Muslim clients ask us exactly that, is it ethical? And we tell them, yes, it is, because it doesn't cause any harm to the mother or the baby in collecting these stem cells.
It might save lives. So if nothing else, Jewish and Muslim patients are very practical when it comes to saving lives. You can.
Exactly.
And what about Jehovah's Witnesses? Is this against their beliefs, or may they use stem cells at a later stage? I don't say for aesthetics, I mean more for the other indications.
Honestly, I'm not too sure about Jehovah's Witness. I know that they, correct me if I'm wrong, I don't want to sound ignorant, but I don't think that they can use other people's products, but they can use their own. And I think, if the baby is a Jehovah's Witness and they do a collection, that's the baby's own stem cells and umbilical cord. So in that case, I don't think there's anything wrong with it. But obviously, I'm not affair with the Jehovah's Witness, beliefs, but I could be corrected.
Yeah, I think if the blood leaves the body, there might be an issue with that. But I think that's why they do these continuous blood transfusions. So auto transfusion, if there's a continuous circuit between the blood and the.
Oh, okay.
Those are kosher.
Well, it's okay for Jehovah's Witnesses.
Yeah. Okay.
But yeah, anyway, that's maybe we're getting a little bit off
piece.
There are a few prompting some great questions, just Sameshni. Fazila Munshi has said platelet-rich plasma is used in ovarian regeneration.
Ovarian regeneration.
Yeah, I think
that's actually really interesting, because I'm actually touching on that in my, I think, second last slide. We did a clinical. Yeah.
You keep your powder dry. Because then the next question from Marcus Feisen is on the same topic. Can stem cells be used to make gametes, oocytes, and sperms? And you'll be coming to that too. Okay,
and I'll be coming, So to make oocytes and to make oocytes and sperms, I won't be directly touching on that, because I'm not too sure in the fertility space how it would work to create oocytes and sperms, but I'm coming to ovarian regeneration. So I think that will, in conjunction, create oocytes and then sperms. So maybe we'll touch on it. So yeah, this was basically aesthetics and the use of adipose-derived mesenchymal stem cells in aesthetics and the possibilities. Okay, let's go to the next slide. And then I want to talk about, stem cell therapy in sports medicine. I think it's a very up-and-coming field, especially. Well, it was always an up-and-coming field, but it's always something that causes a lot of concern because, you know, sports injuries, as mentioned here, can be acute and chronic, and prevention is very important in this field of injuries. So especially now that there's more women going into the field, more middle-aged people in the field, injuries are bound to happen. And I think it's just our responsibility, or it's just the way the world is moving, to try and reduce the frequency and just increase the repair and reduce recovery time for these athletes. So just an interesting fact on sports injuries in the US, the amount of or the estimated cost of acute injuries in only college level is about $1.5 billion. So this is how much they spend on treatment of acute sports injuries in college level. And that doesn't even touch on follow-up rehabilitation. That's just your primary, you know, appointment and your primary care. So, you know, with this burden, it just means that once an injury occurs in the sports industry, and, you know, there's a long time there's a long period of time for this injury to repair. It just means that most people can have an early retirement. So the whole point of this is just to increase the time that they're in this field. So just to touch on it, how this would work is people can harvest the stem cells from the patient's fat, their blood, and the bone marrow, as I've mentioned. So fat, as I said, it can come through liposuction, so they can harvest adipose stem cells from liposuction. Umbilical cord stem cells, I've mentioned, has the mesenchymal stem cells, and the bone marrow, which is the way most people know how to. And then just how they would do it is they would remove the stem cells from the body, grow it in the lab, and develop it so that it would expand in number and give it back to the patient at the site of injury, usually.
Can I just ask a practical question here, Someshni? You said the umbilical cord, a sample from the umbilical cord can be used to harvest mesenchymal stem cells. Now, whose umbilical cord is used? Can anybody donate it, or where does it come from? Because if a person has the umbilical cord harvested at a cesarean section, for example, they probably won't be too happy if some college jock wants to use some of that MSC for their strained back. So where would you get it from?
So maybe your family member stored or cryopreserved the umbilical cord. You know, maybe a friend you know stored the umbilical cord for the baby at birth. They can be, you don't have to only, you know, rely on the umbilical cord. Obviously, there's other ways to get that stem cells, like liposuction, but you can always see if anybody had that umbilical cord cryopreserved. And the great thing about the umbilical cord, it doesn't need to be tissue matched. So we don't need to do an HLA type match for that stem cells to be transplanted into someone else. Okay. But that's the great thing about the umbilical cord.
So if I donate blood, which I do, can I also donate stem cells from my child's harvested stem cells, or from the umbilical cord? Or if I have it harvested, it belongs to me? Or do you sell them? How do they work?
So yeah, we can't, I think we're not at the point in South Africa where we can sell these biological materials. I would just think that if you're a transplanting doctor and, you know, or you as the patient have someone who has something stored, you can donate it. You can ask someone to donate the umbilical cord stem cells to you. And if they're willing to, you know, then your transplanting doctor can tell us what to do with it, and we will release it to who you tell us to release it, you know, at that point in time.
Thank you.
And then we can, you know, so because of the increasing popularity of the use of mesenchymal stem cells, it is very widely used now in sports medicine. So we can use it to treat damaged tendons, ligaments, and cartilages, which is your biggest sources of injury during sports. And how it can be applied is by a direct surgical application. So we can, you know, directly apply the stem cells into the torn ligament, the tendon, or the bones. We can create sort of a stem cell bearing suture. So the sutures to stitch together the torn muscle, the ligament, the tendon will be coated in stem cells. Obviously, the suture will be dissolvable. Or we can just do an injection directly into the site of injury, and that will stimulate healing and anti-inflammatory responses.
Can I just ask you, Someshni, so are those sutures actually already available, those stem cell bearing sutures, or is it still something in the research?
It's still something in research. It's not something that's a clinical application right now. I guess it's still, being clinically trialed out. It's not something that's currently available. And then, coming to something I think that might be a bit more relevant into the obs and gynae space. We'll talk about perianal fistulas, and we'll get to rectovaginal fistulas in just a bit, and how we can use stem cells to possibly treat that, or how they are currently using it in some clinical research. So, Crohn's disease, usually people with Crohn's disease may develop, like from the percentage that I've read, it's about 30 to 70% of these people might develop a perianal fistula in their life. And usually what happens, obviously, there's an infection, and the anal gland then turns into an abscess, and then that requires a surgery. So obviously if it's left untreated, the perianal fistula may leak fecal matter and will cause, sometimes in your worst case scenarios, a cancer. So, after medical control, the goal is to heal the fistula and to preserve fecal continence. And some of the surgical procedures currently being done is a sentin placement, fistulotomy, fistulectomy, endorectal advanced flap formation, or to fecal diversion. And some of the recent studies showing adipose, especially adipose derived mesenchymal stem cells, show how they can show or provide an anti-inflammatory and an immunomodulatory potential. So this is a good, promising aspect in this field. And then basically what would happen is, after we've multiplied the stem cells from whatever region we've got them from, so usually a liposuction, they will be combined with a dissolvable plug, or will be combined with a plug from a dissolvable material, bioabsorbable material. This plug will then be surgically inserted into the anal fistula. And then this patient in this trial, what I'm speaking about, was monitored 7 times in 1 year. So the clinical healing can be confirmed with deep tissue imaging, but in this clinical trial specifically, or this research specifically, they documented 14 out of the 20 patients that had complete healing, and then after 6 months, and then 13 patients after 1 year. So it does show to have worked. And then, in a few years, hopefully we can make this a routine clinical procedure. And just to mention here, as I've mentioned before, the same application could potentially be used in a rectovaginal fistula. And we were in contact with gastroenterologists, interestingly enough, from Donald Gordon, the hospital, and they told us that they find this very interesting. So what they want to potentially do is store adipose tissue from certain patients, and in hopes that we can sort of replicate this, and sort of, instead of using a biodegradable material in the form of a plug, we can kind of use it in the form of an injection, and inject just outside the perianal fistula or rectovaginal fistula, and hopefully that will cause healing in the fistula. So nothing has been set in stone yet, but we want to get the ball moving again with the gastroenterologist from Donald Gordon. So I mean, if it's something that anyone out there is interested in, or wants to actually, take a chance and try this out with patients, or you see some potential use in, especially rectovaginal fistulas in your space, we can always see what we can do from harvesting those stem cells from the adipose, storing it for you guys, and then we can take it from there.
Well, Sameshni, you're talking to the right people, because Professor Jeffrey here is a great fistula repairer. And Steve, do you see any use for us in your field of fistula repairing?
Yeah, I mean, I think we will probably need to have a decent discussion offline, but we are actually, our research group at the foundation, and Jan-Paul Rufus from the Netherlands is very interested in not yet looking at rectovaginal, but actually vesicovaginal fistulas. And we were starting to work on amnion, interestingly, and we actually started a sheep project where we created a fistula in sheep. And the next step was to look at, plugging the hole with amnion. But yeah, so I don't know what your thoughts on that. And I thought maybe it's not really the right time to ask on amnion, but I think that's exactly what we were thinking about. And I was using a lot of amnion to do other tissue healing applications.
Well, you could coat your amnion with stem cells, Steve. And as just as we've heard, Sameshni said, you coat plugs with.
Yeah, exactly.
Yeah, the space is very wide open for a lot of research and a lot of development. Unfortunately, it just seems that there isn't a lot of money going into this type of research, and we do have a lot of ideas, but trying to get funding for this stuff is actually quite
Well,
difficult.
next
So,
bioscience is your
Yeah.
next port of call, Steve.
yeah, we'll we'll have a discussion offline. Thanks
Right,
so much.
offline.
But
Thanks
yeah,
very much.
yeah,
No, definitely. I think it's something definitely worth exploring. And that's why I mentioned, our conversation with Donald Gordon, because I think not a lot of people know the potential out there in the use of stem cells in the specific spaces. And that's why it's always good to have these conversations. So it kind of drives the wheel of thought and, sets things in motion, because I think South Africa and the use of stem cells are quite far behind. We don't have a lot of current clinical trials. We don't have a lot of uses here. So it would be great to start something. Interestingly enough, we are using amnion as well, but we use it, I think, more for wound healing. So we have something called, I know it's a different discussion, but just I thought I'd mention that.
yeah. No, absolutely. It's I know they actually did look at stem cells for stress incontinence. That went straight all the way into human trials, but I don't think anything came of that.
No, that was 20 years ago.
Yeah,
The Austrians did it, but it never got off the ground.
yeah,
But I mean, Steve has this experimental farm, the University of Stellenbosch, and he's at the forefront of not only research, but also teaching. So offline, perhaps, Sameshni, you can get hold of him. There's another question from Graham Birdsley about the differences in community banking and private banking. Perhaps you come to that at the end, Steve.
Sure, no problem. We can do that. So I will touch on my last clinical piece for this presentation. And this, I think, is where the previous conversation or the previous questions came into play. So just to give you some insight before I dive in. So Next Biosciences, we partnered with BioArt Fertility Center here in Johannesburg in Rosebank. And we did a clinical trial in which we tested stem cell application from adipose tissue with patients who had poor ovarian rejuvenation or poor IVF. So we wanted to see if there was any ovarian rejuvenation or if anything happened if we had to induce or introduce stem cells to the ovaries. So just to take you through what the clinical trial was about. So because the application method, there were different application methods tried to kind of create ovarian responsiveness. And these patients were all poor ovarian responders, and they had poor IVF, histories or journeys. And in the study, they were recruited. So there's 21 had lower than expected reserves. So 21 people had lower than expected reserves for their age, and 9 had premature ovarian insufficiency. 10 patients were randomized into a placebo group, and 20 were part of the intervention group. So stromal vascular fraction was taken from the adipose. So each patient was liposuctioned, and we collected the adipose tissue or the adipose mesenchymal stem cells, and we spun that down and created SVF, or got the SVF from that. And we introduced that back into the patients. So 3 equal insertions were done, adjusted to the ovarian volume, and were given at a monthly interval. And it was done via ultrasound guidance. Now we gave about 1.6 million mesenchymal stem cells, and the percentage of these mesenchymal stem cells is about 13.2%. And then to date, so the conclusion of this result, or the conclusion of the study, was that to date, 12 people have undergone ovarian stimulation and IVF, and after stem cell therapy. And of this, 9 had embryo transfers with resulting in a pregnancy rate of 33%. And then from this, there were 2 spontaneous pregnancies as well. So overall, they say it was a successful, research. And although it's experimental, it just provides further support to see how this approach can be encouraged in the future. So that was basically our part in this clinical trial, and the clinical trial where we tried to see if stem cells had anything to do with ovarian rejuvenation. So I don't know if that maybe answered the questions that were out there. I think Fazila had that question.
Yeah, I think it does, Steve. Thank you very much.
Yeah, so it did show positive results.
Sameshni, are you still with us? Hello,
Yes, I am.
Sameshni?
Can you hear me?
For a moment, we lost you there. Yeah, thank you.
Sorry. I was just saying that it did show some positive results. So hopefully in the future, we might see a bit more use of these stem cells in ovarian rejuvenation, and maybe it might go a little bit further and maybe it can help a few more people.
Thank you.
Yeah, and then that's the end of my presentation. So I think I'll answer the question of.
Thanks very much. It's wonderful that we've had it. If I can just pick up, there are lots of questions coming through. The first one's from Graham. Please expand on the differences in community banking and private stem cell banking in our country, South Africa.
Sure. So Next Biosciences offers this very particularly or specifically. So we have private banking, which is, if you want to store for you or your baby and your family, you have the right to do so. So no one else will be able to use those stem cells. You're doing it solely for the purpose of your family's usage in the future if you need it. And then if you do community banking, it's half the price of private banking. And it just means that we're trying to pay it forward and create a pool of stem cells that potentially can be used in a public bank. But still, you're storing this community bank, or you're storing these stem cells for your family, for the baby, but you'll also, in the same breath, be registered on the South African Bone Marrow Registry, which means that if anyone else needs a bone marrow match or a bone marrow transplant and is in bone marrow match or tissue type match to your baby's stem cells, they have the options of using that baby's stem cells as well. So you're kind of storing it for you and anybody else in the country in the community bank option.
Thanks very much. Now, what about, I've got I do 24 Caesars per month. What about somebody that wants to donate their stem cells and a piece of umbilical cord merely for the use of community projects? Can you do that? In other words, they don't pay any money towards Next, but they give their stem cells and their umbilical cord. Is that possible or not at this stage?
I think that would fit into something that would be a public bank. And unfortunately, in South Africa, there's no formed public bank in that sense. So you can't just donate it and, it will be for anybody to use. Unfortunately, you have to pay to store it. And that's why we try and kind of bridge that gap between private and a public by the community bank option. So you're paying half the price, but you're also putting it on sort of the South African public.
I get it. If you do so many Caesars as I do, it seems to be an awful squandering of human tissue just to let all of that umbilical cord and all of that stem cell umbilical blood go to waste. But, it goes to waste. It goes down the drain and it's incinerated or something. So it just pains me to squander all that tissue for nothing. That's why I was wondering.
That's such viable, rich biological material that someone could potentially use, but unfortunately they have to store it, and pay something to be able to store it. And that's I think that's the big problem we face in South Africa by not having a public bank.
No. And there's another question over here, Steve. Before you get to your questions, it's about delayed cord clamping. It's all the rage nowadays. I don't know about Johannesburg, but in Cape Town, it's all the rage to have these things called birth plans and delayed cord clamping. The practical issue is if you do delayed cord clamping for a minute, there goes all your bladder off to the baby, and harvesting stem cells and harvesting umbilical cord blood seems to go out the window. I know I've seen from Next, they say, no, you can still do it. But from a practical point of view, from a person that does lots of that, I say that when the baby's had its share of blood, there's not much left over for the stem cell bank.
Yeah, I think that's the tricky part with delayed cord clamping. I think it depends. I mean, now the patients want to do it and you can't say no, but at the same breath, they also want to do stem cell banking. So we do say, according to WHO and the American Gynae College Association or Organization, they do suggest that 30 to 60 seconds of delayed cord clamping can be done as well. Then you can do the cord blood collection. But as you're saying, you are the specialist in that field in the sense that you see that there's not enough blood, usually after delayed cord clamping. So I can always suggest if 1 minute is too long, 30 seconds should be enough blood going back to the baby and still being enough there for a good stem cell collection.
Well, I've got a better idea. I'd say first take the stem cells for, say, 2 or 3 minutes, and if there's any left over, the baby can have the rest. How's that sound?
I mean, you guys are the experts if that's something that you can't, but I think the only thing is, yeah, I mean, it is a possibility. We usually see people cut the cord, clamp the cord, and then insert the needle. But I mean, there's always a different way of doing things, getting the same outcome. But essentially, we need a volume of 50 to 80 milliliters of cord blood. So whatever we can do to get that volume, as well as not putting the baby or the mother in harm.
I can
that's
tell you
perfectly
this,
fine.
in real life, Sameshni, getting 50 or 80 mils of blood after the baby's had his share of delayed cord clamping blood is practically impossible. So if you can keep your face straight, and with a straight face, take the cord blood and then the baby gets the rest, Steve, that's about the best you can offer. And you know, to be honest, what's more important, the baby's share? If it's a term baby that's otherwise healthy, what does it need the extra blood for? It's different if it's a little prem baby and it's like 30 weeks and it's got IUGR and it's struggling, then it can by all means have its extra blood. But if it's a term baby, I'd say give the stem cell bank the blood and the baby takes the rest. Eh?
Yeah, sounds like a good idea.
Is that ethical, do you think, Steve?
Absolutely.
Yeah.
Yeah, I think it's ethical.
Or do you think it's ethical, Sameshni?
Yes, I mean, it's not causing anybody any harm.
Can't hear you.
No.
Oh, can you hear me?
And now I can hear you. Your lips are moving.
Okay.
You as well.
Sorry, I don't know, maybe it's our side, but yeah, I think it's not causing anybody any harm. It's not putting the child's life in danger. It's not, causing any harm to the mother. And it's a positive outcome for both scenarios. The baby's getting what they need and we're getting a good share for cord blood. So
Okay. Can I ask another question? You said you're doing research with the infertility clinic. You mentioned the name in Johannesburg. Are you, or is Next Biosciences, now I know you're the product manager of stem cell banking, so you're obviously a person with huge clout. What happens if my colleague over here, Professor Jeffrey, wants to start a project in conjunction with the University of Amsterdam on the community-based treatment of women with fistula? And there's tens of thousands in Africa. It would be a wonderful community project, and would give Next Bioscience a lot of kudos and nachas to be involved in something like that. Do you guys do that? Does Next do that? Or
yes, of course. Just to give you some insight, we're actually working with another group of doctors in where they're trying to store this T-cell lineage cells with us and use that in a clinical trial for them to see how it would work. So yeah, we do that. We're most welcome to do that. We love getting involved to kind of show the potential and power of stem cells, and anything that we can do is great. So usually what happens is sometimes the doctors do the liposuction, we use the adipose cells, we store them, and when the doctors need the cells, we give them back. Or if they, it depends what kind of stem cells they're using. Is it adipose, is it umbilical cord? Then we usually store it and for the doctors, and when they need it, we release it for the doctors for this clinical trial. So yeah, we definitely get involved in that kind of work.
if you can get hold of Sameshni, that would be wonderful.
No, look, I mean, I think I think it's great to have this technology in South Africa, and to know that there is a group looking at the use of biological products in research. But unfortunately, some of these very early basic science or preclinical trials do cost quite a lot. So yeah, we obviously need to look together at much huger funding models, because I don't think companies often have enough money in the R&D to take it all the way through to the final development, because you actually need multiple layers to these projects. But absolutely, we'll look at that. And I think they're getting such good results in the rectal vaginal fistulas. It's be exciting to look at what we could do in the small vesicovaginal fistulas.
Yeah.
So, and also I love the concept of using it in the sutures. We're still using meshes in gynecology, and I think the next step in pelvic floor research is a sort of a more sandwich type mesh, with maybe some stem cells, resorbable mesh, something that stimulates growth of collagen, but also stimulates the body to lay down, newer materials. So it's a very exciting field, and we just need, we actually need a lot of cash to do this research. And that's
at least Next can provide the stem cells and the mesenchymal cells. There's another question over here. It says, if a person, where do you get these mesenchymal cells for fat? Does it have to be autologous fat, in other words, from the patient itself? Or can you donate mesenchymal cells from your own liposuction detritus?
Yeah, it usually is from the same person. It usually is from, we do a little, or the doctors do a little harvesting from liposuction. They store their own cells because it's going to go back into their own body, so there's no cross reactions. So usually for these mesenchymal stem cells derived from adipose, it's usually from their own bodies.
I can't get a bit of liposuction and donate some of that to.
You could.
Just a completely different question on a different tack. Maybe some people want to know what is the cost these days, out of pocket cost for a patient wanting to store their baby stem cells? What are we talking about?
So it depends. We have quite a few options. We try and make it as affordable as possible. So for the private banking, there's a cost around, so you'd have a 4,000 registration fee and a processing fee and a storage fee. If you're a Discovery member, you get an additional discount with us. And so basically you're looking at about, sorry?
Oh, that's just the registration.
That's just the registration. So after the registration, that means that we will send the kit to the patient. They will so that registration fee covers the kit, the maternal bloods. We pay the gynaes a collection fee after they do this collection, and that's where the money comes from. And the courier fees is part of that 4,000 Rand. We have a processing fee and then a storage fee. And basically, as I've mentioned, if you're a Discovery member, you get an additional discount. But depending on your options, what you choose, either you choose cord blood only, cord blood and cord tissue. You have the option of 10 years and 20 years storage. So depending on what you use or what different options you choose, the most you're looking at is about 33,000, 34,000 Rand in total. So we also offered payment plans. So, that's obviously a lot of money for people to pay upfront. So we can give them a payment plan like a cell phone contract or a house. You have 12, 24, and 60 months. So you can take that up and break it down into that kind of payment plans if that works out a bit more cheaper. And then the community bank is half that price. It's about 15,000 to do community banking. And then, if someone else in the country uses that stem cells and not your family, we will reimburse you the full amount.
Okay, so Meshni, what is the likelihood, another question, what is the likelihood of a person requiring stem cells once they've donated? In other words, how many families would call upon you to say, listen, we've got a baby that's got a childhood cancer and we need it. What are the chances? 1 in 1,000, 1 in 10,000? What sort of ballpark figure?
Well, we're looking at in the past 17 years that we were running as a company, we've done 3 releases. So 3.
3.
So 2 were for a part of a clinical trial in the Duke University where the parents wanted to be part to see what would happen if they use this cord blood to treat cerebral palsy. And 1 was for thalassemia.
Okay, thank you.
Interesting. Yeah, one last question before we go from Emmerich Frolish. 30 seconds to 1 minute late cord clamping is often impractical, potentially. 3 to 5 minutes delays might negatively impact on the baby and possibly the mother as well. So, yeah. So you must.
So hang on, I don't just explain that, Steve, to me. 30 seconds to 1 minute late cord clamping is often impractical, potentially. 3 to 5 minutes delays might negatively impact on the baby and possibly the mother as well.
Yeah.
Now, hang on, just explain that to me, Steve. I mean, I know Emmerich well. He often comes to our refresher courses. He always comes to our refresher courses. But as far as I understand it, you don't actually have to cut the cord. You don't have to clamp and cut the cord. You can leave it there for as long as you like, really.
Yeah, I mean, I'm not an obstetrician, but I mean, I suppose you keep the baby warm and, do it like that. I don't know.
No, but
I don't know.
What I'm saying is when I was a medical student in Pretoria, where you come from, old Granny Evans used to had a special shelf. And then when the baby's delivered, we wouldn't cut and clamp the cord. We would leave the placenta attached and put the placenta on top of a shelf and let all the blood run into the baby for half an hour.
Okay,
so,
wow. Okay, sure.
Yeah.
Okay.
Look, that was a bit eccentric, but
yeah, that's quite long, eh?
it didn't harm the baby.
Yeah. All right. Well, I think it's a good discussion.
We've had lots and lots of interesting questions.
But basically, you said that we should. She said that we should collect the stem cell and then let the
baby have the rest. Yeah, but the baby can have the rest. You can leave the cord attached to the baby for as long as you like. I mean, in prehistoric times, people just left the cord
Yeah.
and it until it kind of rotted away, didn't
Yeah.
it, Steve?
Yeah.
Steve, you've
In
just
your
had a
day.
baby, eh?
In your
In
day.
my day.
Yeah.
You've just had a baby. Did you have stem cells?
No, we didn't. I was just thinking about it, and especially they become like great sportsmen. Maybe they go to the Olympics. They
Well,
might
you
win.
could
They
use
might
your-
need their spends.
You could use
That's
your,
my only regret, actually.
no, but you could use the stem cells yourself.
You're right.
Yeah. Or
Yeah, no, No, look, I mean, it seems that the current application for the cancers is maybe going to become secondary, and we're going to be they're going to be wanting these stem cells for a lot of other stuff,
yeah.
and that's really what I took
And
out
that's
of
good,
tonight.
isn't
Yeah,
it?
Yeah,
It's really
yeah,
good. I mean,
yeah.
if you could
know,
use it,
yeah.
and the ever increasing
Yeah.
indications, as you said, maybe aesthetics is
Yeah.
one, but
Yeah.
certainly sports injuries,
Yeah.
other injuries.
Yeah, yeah, that's really seems to be the way it's really going, and the fact that there were only released 3 is irrelevant in that. If you've got these things in 30 years' time, your baby might say, "Well, where are my stem cells, Dad? Why didn't you bank them?" Because I couldn't
No, but
clean
they
up
only
the-"
last for 20 years, Steve.
No,
You-
they don't. I mean, not technically. There's research to say that they can last, indefinitely, under the right circumstances, if frozen correctly, under the right
Only keep
temperatures.
it for 20 years, don't you, in
We-
your bank submission?
Currently, yes, we do keep it for 20 years, because the longest stored stem cells current at this point in time in the world is 23.5 years. So as the research goes to show that there's validation in keeping it longer, and the viability of the stem cells will not decrease as time goes on, we will also increase our storage times as per indications internationally.
You're not going to destroy after 20 years and say, okay, time's up. Let's just
No, of course not. But you guys actually hit it on the head to say that, I think you'd rather have something safe, because in the next few years, once this research becomes clinical standard practices, we're going to see the massive increase or the massive demand for stem cells. And it's always good to have something than not have something. And it might be a bit expensive now to store it, and it's a bit, but that's the whole point of education, payment plans, and just giving people options on what they can do with their stem cells.
Yeah, and I mean, it's going to be economies of scale thing. It'll eventually become like a cell phone. Cell phones are very expensive.
Oh.
I'll just have like whole banks of these things that everyone keeps the stem cells, and you'll go and fetch them, and
yeah.
do what you do what you need next for it. So yeah, we look forward to the space. We really like thinking about the future, and it was a great talk. Prompted a lot of thought,
A lot of
and
questions.
we'll remember
Thanks,
this
Emma
maybe in
Strudwick,
about
for your
20 years'
question,
time,
and everybody at
yeah.
Graham Birdsley's
Yeah.
question as
Yeah.
well, and
Yeah.
Veronique's question, and all the other questions, some of them anonymous.
Yeah.
Hang on, there's another one.
No, that's it, Peter.
Oh,
The
that
questions are finished now. So
Okay.
yeah,
Well,
great.
look, thanks, Steve. Would you just thank once again Sameshni?
Yeah, well, thanks so much, and we do thank you for your time, and really prompting some great discussion. And sorry we interrupted you so much, but it was that sort of conversation that.
No, of course, I loved it. And I think that's the whole point of this. It's just for us to talk and collaborate and, prompt these questions and get our minds thinking and get the wheels turning. And I think it just creates such a good space for us to just have these conversations. So thank you for allowing me to speak and present on this. And I just think from my point of view, or my, takeaway from this is just, I hope that I created some awareness on the importance of stem cell banking and the importance of the use of stem cells. So if you guys have any questions, you know where to contact me. Please give me a call. I'll be in touch, Steve, to see what we can do and take it from there. And we can just if you have any questions, please reach out to me.
So much.
Thank
Thanks
you
so much,
very much.
Sameshni.
Thank you.
And to everybody, firstly, a thank you to Professor Jeffrey and the Pelvic Floor Foundation of South Africa. We look forward to seeing you again in the same time, same place, same space next week. We're going to have another presentation. Keep warm tonight. It's going to be 1 degree Celsius in Cape Town, Steve. So keep yourself warm. A special thank you there. And we're going to play out with a video,
Yeah.
are we?
Yeah,
Yes.
thanks, Karen.
There's Karen. Thanks. Thanks, Corin.
Thank you very
Thanks
much.
very much, Corin. And you're going to play out with the video. Safe home.
Yes.
And a final thank you, Steve, for the use of your mini bar. Thank you.
Pleasure.
Play the video, Corin.
Yes.
out of the chaos and uncertainty of change, something extraordinary is happening. Evolving, becoming, birthing. A world where science fiction becomes science fact. Where we can reduce the risk of genetic disorders before birth and eliminate the inheritance of genetic conditions. Where we can collect stem cells and cryogenically store them for future potential therapies. And harness the healing power of the placenta to create regenerative biological products. Where we can create tests to detect viruses to make the world a safer place. A world where disease is no longer inevitable and the possibilities for restoring hope and health are limitless. Welcome to the world of Next Biosciences. Nothing is inevitable. Anything is possible.